Personalized heart health care. Why one size does not fit all. Hi, I'm Dr. Phil Ovadia, your guide to personalized heart health care. Today, I'm going to break it down because most people don't realize that heart health isn't a one-size-fits-all matter. Here's what we're going to talk about today. The critical importance of personalized care in heart health. How individualized strategies lead to better health outcomes, and the steps that you should take to ensure your care is tailored to your unique needs. Let's get started by talking about the critical importance of personalized care in heart health. I want you to understand why generic health advice doesn't work for everyone and the science behind personalized care. We've been told for too long that your doctor has likely been educated that they need to follow the guidelines and apply those to all patients. They no longer have the ability to think about how it may apply to your situation and understand that the scientific studies that are done to develop those guidelines are usually done on very limited populations and may not have anything to do with your personalized situation. I want you to learn about the factors that should influence your personalized heart health plan, including genetics, lifestyle, and existing conditions. These can all play an important role in understanding how your personalized heart health needs to be addressed, and your doctor may not be considering them. Finally, let's talk about the role of comprehensive assessments in developing a tailored heart health strategy. Is your doctor doing a full assessment when it comes to your heart health? Have they done a comprehensive blood panel looking at all of the various factors that play a role in heart disease? They need to go beyond the basic cholesterol metrics, which is all that the guidelines really require, and think about things like insulin resistance, inflammation, and advanced lipid markers that can truly help you determine your risk of heart disease. And finally, have they gotten imaging to look at your heart? If we're worried about heart disease, then imaging to look at the heart should be an important part of this. And I believe that most people should be getting coronary artery calcium scans as a great first step. Now, let's talk about how individualized strategies lead to better health outcomes. I want you to discover the benefits of a customized approach, from improved management of chronic conditions to enhanced overall well-being. I've lost count of the number of patients in my practice that have been able to get off of medications for chronic conditions like high blood pressure and diabetes that they were told were lifelong progressive conditions. That's what I was educated to believe, but now I know better, and you should be getting better from your physician. I'm going to give you one real-life example of how personalized care has transformed heart health for individuals. This is the story of a 60-year-old gentleman who came to my practice being told that he had no options but to take lifelong medications and accept the fact that he was going to need heart surgery. And when we started working together in just a few short months, we were able to get him off of medications for blood pressure and diabetes, and we were able to relieve his symptoms of heart disease. He is now well on his way to a much happier and healthy life than he would have gotten from just following the guideline advice. Next, we need to understand the importance of ongoing adjustments to your heart health plan as your needs and conditions change. And this is where working with a practitioner that is going to do ongoing assessment, repeat blood work, and imaging studies to really understand what's happening with your heart health. Is it getting better? Is it getting worse? Is it staying the same? What factors are changing that are going to adjust the components of your plan and help you to reach your ultimate goals when it comes to your heart health? Now, if you have questions or need more information on any of the topics we've discussed, please feel free to ask. Engage in the comments below and make sure that you subscribe to this channel so you continue to get great videos like this. Now let's wrap up our discussion on your personalized heart health by talking about the steps that you should take to ensure that your care is tailored to your unique needs. Let's talk about some questions to ask your doctor to ensure that they're considering all aspects of your health in your care plan. Start by asking them if the recommendations that they have made are based on guidelines alone, and if they've considered how those guidelines may not take into account your unique situation. Ask them how confident that they are that you and they, working together, have a complete understanding of where you stand in regards to your heart health. Now, it can be challenging to advocate for yourself and communicate effectively with your healthcare provider about your heart health goals. But don't be afraid. If you're not able to have an open conversation with your practitioner regarding your health and your health goals, a good doctor will take the time to make sure that you are comfortable with the recommendations that they've made and that they are aligned with your health goals. And if your doctor won't take the time to do so, push them or consider getting another practitioner. Let's talk about ways to recognize that it might be time to seek a second opinion to get that personalized care that you deserve. If you are simply not able to engage in that conversation with your doctor, if your doctor doesn't give you the time or won't listen to your concerns and isn't addressing your individualized heart health goals, it is time to get a second opinion. And the good news is today, it's so much easier to do that. We have the internet and all of the vast resources that come with telemedicine at our disposal so that you are not limited to maybe just one doctor that happens to be in your local area. I encourage you to take charge of your health. And remember, put comments below. Let us know other topics that you would like to hear about. Send us your questions and always feel free to reach out to my team if we can help you with your personalized heart health care.